you everyone for giving me this opportunity. I'm presenting from South Africa, which is a continent that has abundance of sunshine. Next slide. I don't have anything to declare. Next slide. So this paper was published under Biomedical Journal of Scientific and Technical Research in 2020. It was vitamin D combination of osseous and non-osseous benefit with supplementation. Next slide. We know that vitamin D is a micronutrient, and we mostly get this from sun exposure. Next slide. How much is adequate for getting vitamin D from sun exposure? There've been a robust discussion of how much is suitable to get vitamin D from the sun. Some, they say that 15 minutes of total body exposure during midday is sufficient. However, we should remember that too much sun exposure can result in skin cancer. So nobody knows how much is adequate. If you expose yourself during midday during summer period, you will probably get about 10,000 international units. However, if your arms and your face get exposure during the same time, you'll get about 400 to 600 international units of vitamin D. There are things that they can hinder you from getting sufficient vitamin D. For instance, if you put your sunscreen, long clothes, as well as your melanin can also affect your exposure. Next slide. During COVID, and we're still experiencing some cases of COVID, vitamin D has been shown that it can be implicated in regulating number of genes which are responsible for cell proliferation, cell differentiation, as well as apoptosis. Again, vitamin D has been found to maintain tight junctions, of which it's very crucial in fighting with various viruses as well as microorganisms. Next slide. As I've alluded, is that we all face the pandemic of COVID-19. Vitamin D was also part of treatment for COVID-19. There have been more than 200 viruses that have been implicated in upper respiratory infections. And it has been shown that vitamin D can also assist in enhancing cellular immunity. Supplementation of about 500 international units per day was found to be fundamental in improving innate immunity. Vitamin D during COVID has been, okay, even now we're still facing COVID-19, although the cases they are lower than the previous years. It has been shown that vitamin D can also assist in reducing the cytokine storm that is induced by innate immunity. Next slide. There has been some report that plasma renin activity and high angiotensin 2 as well as angiotensin activity can be due to low levels of vitamin D. Vitamin D has been shown to assist with stimulation of surfactant synthesis, which is very important in fighting with the epidemic that we all faced from COVID-19. Next slide. There are various conditions that all orthopedic surgeons they are aware of that are associated with vitamin D. One can speak about rickets, osteoporosis, osteomalacia, stress fractures, and certain tumors. These conditions, when an orthopedic surgeon is faced with, it becomes part of initial workup. Next slide. Now I'll be dealing with some of the important conditions associated with vitamin D in orthopedics. There was some studies that have found that there are association between vitamin D and the risk of falling. And one should also remember that the vitamin D can also assist with fracture healing and also reduce morbidity. My colleague, I think it's Dr. Coley, that was presenting before me. I would also like her to start doing some vitamin D levels in her patients, just to publish something regarding what she was talking about and vitamin D. However, some studies have not found any combination of vitamin D and calcium as that was associated with the risk of fractures in an adult. They argue that if you combine the two of them, there's increased risk of getting kidney stones. Next slide. Diabetes and bones. We all know that as orthopedic surgeons that a patient who has diabetes can have a problem with wound healing, can have problems with fracture union, can also have a fracture with problems with delayed union as well. It has been shown that vitamin D can also be associated with diabetes. Next slide. We know that diabetic patients, they can also get peripheral neuropathy. Some literature has also shown that patients can benefit from supplementation if they have peripheral neuropathy, if they are having diabetes. Next slide. One of the things that an orthopedic surgeon can encounter in diabetes is that you can get diabetic foot, Charcot, or adhesive capsulitis, osteoporosis, tendinopathy, periprosthetic infections. And management of these complications that are associated with diabetes in orthopedics is that they can tend to be highly costly. Hence, knowing the levels of vitamin D can reduce the cost of managing these conditions. Next slide. Again, some literature has found that if you know the levels of vitamin D, can also assist in terms of pain management with various orthopedic conditions. Next slide. Again, knowing the levels of vitamin D can also assist with osteoarthritis because there's been an association between low vitamin D as well as osteoarthritis because of changes that occurs in the subchondral bone. However, the role of checking vitamin D in patients that are going through for arthroplasty has not been established, but a study that was done in South Africa, in Cape KwaZulu-Natal province, has found that doing arthroplasty for osteoarthritis patient was associated with low vitamin D, but the long-term effect of the study, we don't know about it because the study was done less than 24 months. Next slide. Patients who present with inflammatory bowel diseases, we know that most of them, they can get steroids to manage their conditions. And as an orthopedic surgeon, you know that steroids, they are not friendly to the bone. They can result with a avascular necrosis, and then that will also cause patients to get hip replacement. So giving patients supplementation if they are having inflammatory bowel diseases will result with a less usage of steroids. Next slide. Tuberculosis. Here in South Africa, tuberculosis, if you don't know TB, you will never pass for your undergraduate. It's a common condition that we encounter. I'm talking about the pulmonary tuberculosis because of the effect of HIV. It has been found that if you have low vitamin D, chance of you having clinical diseases is more than 5 times. Orthopedic surgeons, they've also seen that having a spinal tuberculosis can also associate it with low vitamin D. Again, children that we see this side is that they also have a low vitamin D if they present with various osteoarticular tuberculosis. Next slide. Having a patient with complex regional pain syndrome is a nightmare. Some studies have shown that postmenopausal women who sustain distal radius fracture tend to have low vitamin D. Next slide. Managing orthopedic patients, it can be a nightmare, more especially if you are going to manage them for longer because of the association of depression as well as their conditions can make your life to as a surgeon to be a nightmare. It has been shown that mood in diabetic patients has been improved with supplementation. Hence, if you You give patients vitamin D for non-traumatic or traumatic orthopedic conditions. This can also alleviate or prevent depression. Next slide. In conclusion, is that giving patients vitamin D can have multiple benefits, whether osseous or non-osseous. Although there's still controversy about the issue of preventing falls in an elderly, we believe that giving these patients supplementation can be beneficial. The role of giving patients vitamin D can result with less analgesia if a patient has a chronic pain. And we know that analgesia, more especially non-steroidal anti-inflammatory, are having major complications like the issue of renal failure as well as gastritis. So if you combine your vitamin D and with NSAIDs early, this can result with chronic usage of NSAIDs. Next slide. This is a dilemma because the US Endocrine Society does not recommend that you do routine screening. In my practice is that whatever your condition that you're having, whether you're having a Achilles tendon tear, I personally have check vitamin D. And in most cases, although Africa has a warm and sunny in condition, but I've found that the majority of my patients, they tend to have low vitamin D. So anyone who comes in my practice, whether you have gout, you have what, vitamin D becomes part of my routine. Although it's not part of the protocol that our association has developed. I believe that we need to have further trials in order to determine the importance of having vitamin D, as well as appropriate guiding of who should we screen, supplement. In other countries, is that their cereals and part of their milk, they have added vitamin D. Next slide. In conclusion, vitamin D, vitamin D, vitamin D, whether you have been exposed to the sun, because in my countries that we have different population, urban, rural, and deep rural. I deal with almost everyone, and all of them, they tend to have vitamin D deficiency. It must be part, I'll advocate that anyone that get a patient vitamin D must be part of the screening. There's no harm in knowing the patient's vitamin D. I deal with the sports people. They also have vitamin D deficiency. Next slide. Thanks.